Hi, Stu.
Hey, Bradley.
Thank everybody for joining us today. Really looking forward to this conversation with Stuart Patterson and LifePod. Thank you to LifePod for sponsoring the Voice of Healthcare Summit. Let's give LifePod a round of applause for that. We also want to thank our other sponsors, Orbita, Pullstring, Lynn Strategy, as well as Speech Booth and HelloFresh that are out there. The Speech Booth camera is out there. We need a couple of guinea pigs for that. We'll try to flag a couple people down. There's a prompt. You can answer a question about voice, you can win a prize. And HelloFresh, they're out there too. Stu, thank you for joining us. So,
My pleasure.
Yeah, so let's just start from the beginning. What is LifePod?
So LifePod is the realization of a dream of myself and my co-founder. The dream is that elderly people are unable, in many, many cases, to access technology because of the user interface. Lori spoke quite a bit about the user interface issues of online services. And really, accessing technology nowadays comes from this phenomena of online services, which I've been in for 30 years. And it's a great model, but it's a self-service model, right? And if you think about it, since the advent of the web, all online services are me serving myself. And if I can't do it, then it's not going to provide anything to me. And so we came up with this idea, or we realized there was this idea, LifePod, and we actually purchased the idea from the inventor. The idea was, why not just make the technology serve the elderly adult as they're aging in place at home? Meaning there is no learning curve. So it's the power of voice, because voice is the most natural interface. Since the days when Bill Gates was on the cover of Time magazine 25 years ago when I was working at my first voice company, he was saying voice is going to be the next big revolution. Of course, it hit the call centers and everybody said, not so much. But since then, it's come a long ways, and as someone else pointed out, I think Nate pointed out earlier in the conference, and I'll try and connect some dots from earlier speakers, the big revolution of Alexa is not voice processing. It's not dialogue management. It's none of that. In fact, many of the people that have experimented with Alexa skills are relearning voice lessons that we learned 20 years ago. But it is far-field microphones. And the far-field microphone array that they came up with worked well. And the ability of that far-field microphone to serve up voice services and online services is fantastic. But as the skills have learned, without the ability to initiate the dialogue from the caregiver's perspective, so the caregiver needs to be given, and we're in healthcare. This is a conference on healthcare. And I am here with a request, actually. I'll cut to the chase so that in case one of your questions doesn't get to it. I'm here with a request for everyone to try and understand this concept of healthcare givers being able to control the Alexa device, or the Google Home device, or the Bixby device, and being able to say, either from the menus that you set up, or from your favorite AI algorithm, it's time to talk to the patient. That's what LifePod does. We provide both the caregiver portal, where they can set up these check-ins, these reminders, and these easier access to voice services, and provides the initiated dialogue that links to these other skills. So, good example, somebody else talked about whether or not, they asked Lori whether or not the Saturday Night Live, Alexa Silver it was called, whether that routine was funny or was appreciated. Yeah, you asked it, I think. So it was a great routine, but I actually don't feel as challenged by it as Lori. I mean, Lori said it's problematic in some ways. I think it actually describes the opportunity, because talking to a senior person or anyone compromised with special needs or any patient in post-acute care situation or whatever is a special situation. And one of the biggest lessons we learned from voice processing 20 years ago or 15 years ago or whatever is that you have to craft the voice user interface to the user and to the use case. And that's what Alexa Silver makes fun of, is that Alexa, well, in that case, it was doing miracle voice processing because it was understanding everything, but it suggested that you need to create a interaction modality, as Nate called it, an interaction model that fits the senior or fits the patient. So, sorry, long answer to a short question.
No, that was great. So, Laurie gave you a shout out this morning, talking about your technology and the operative word being proactive. You know that LifePod is proactive as opposed to reactive. And I just want to ask you, it just seems like such a, I don't think basic's the right word, but it just seems like such an obvious thing. Why is it that LifePod has the only, according to Laurie's slide, I believe, the only proactive voice solution in healthcare right now, and that nobody else has managed to get there yet?
Well, because the voice platforms that are in the home, the smart speaker platforms, and there are three big ones, which I've already listed. Of course, Apple iPod or HomePod wants to be one, but they really aren't on the scale of Samsung or Google or Amazon. But all four of them are chasing each other with the virtual assistant model. And the virtual assistant model is a fantastic model. I just saw an article that came across LinkedIn from General Magic, and they said, we revolutionized virtual assistants. Actually, they were preceded by wildfire. So those of you in Boston might remember wildfire. Wildfire preceded General Magic. General Magic preceded Siri. Siri preceded Vlingo. Vlingo became Samsung. I mean, these guys are all related, but they are all the virtual assistant model, which is the model of online services. And because they've really given this new feel to the popularity of voice or the willingness to use voice in the privacy of my home, and I don't necessarily agree that, I think it was Brett said that suddenly we're going to see more voice usage on the mobile phone than we've seen, because I think there's real reasons why people are much more comfortable using a smart speaker in their home than they are speaking as they're walking down the street or something, or speaking when they're in a room or a meeting. Everybody can chat, particularly my kids can chat, but they don't want to talk on the phone. But back to your point, these guys are all chasing the limits of that model, and to some degree, they are finding out lessons that we learned a long, long time ago. And they're doing it on platforms that are somewhat restricted. So the Amazon development environment, although it was the best, as Devin just said, it's incredibly restricted from a voice user interface design prospect. And so the light bulb hasn't gone off that they should make these things two-way, so that the caregiver who gets a little bit of data about the person going to the bathroom 5 times last night can send a prompt that says, "Good morning, Carol. It looks like you went to the bathroom 5 times last night. We'd like to make a doctor's appointment for you." It's a simple AI indication, but that light bulb simply hasn't gone off. I can say that it started to go off within Amazon without violating an NDA, and Amazon. But Amazon is such a huge organization. They're going after so many things and they're very secretive. But I don't, and I think it's also gone off in the Samsung ecosystem or Samsung management around voice. However, Samsung has a Bixby problem, which Laurie also alluded to, which is they're coming out with Bixby 3.0, and that they hope fixes their virtual assistant problem. So I think the problem is people don't get it yet. And that's my desire here is to convince all of you that the power of initiated voice, proactive voice, sometimes I call it caregiver service voice instead of self-service voice, the potential of that to revolutionize how we support people, other people, not how they support themselves, which is a self-service model, but how we support other people, how the institution of a hospital or the institution of a special needs caring organization or a senior living facility supports other people. The potential is limitless, as the CEO of CCA said in a press release.
So you're off and running. You've got this proactive voice assistant. You've gotten a lot of attention, a lot of hype. What are the share with us maybe the top one or two things that you would point to that demonstrate the efficacy of what you've put together, whether it's metrics or whether it's an anecdotal use case. Share with us how you'd answer that.
I think that's the easiest answer, and it's the one that really dramatically demonstrates what is so different about this model of having the system or service talk to the person according to the way the caregiver has set it up. We've just had incredible testimonials. I was debating with my colleagues whether or not I should put up a slide with one of the testimonials I think we showed you at one point. But when and I think John Locknane mentioned that when we took out the handful of pilot units that we tested with his care partners and his care members, which are these dual eligible patients in their home with chronic medical conditions who are Medicare and Medicaid, and we took those devices out, we got an email from one of the care partners who said, "I'm so glad to hear that we're going to get the devices back," because we told them we'd put them back after a month or so. She said, "Ever since you removed the LifePod, I've seen a decline in her feeling of loneliness, in her adherence to her medication, into her interest, into her verbal acuity," just a litany that came to us from the caregiver. And then we have the person who's here who has put in these 20 devices, and we do these very careful intake sessions with the people where we say to the caregiver, what would you like to set up for the patient or for the resident in your facility or for your mom or dad? And then we say to the mom or dad or the patient or the resident, we say, what would you like LifePod to help you with during the day? And we talk about the arc of the day, and you'd want to remind them of things or offer them music or whatever 12 times during the day, and we say that. And so what they've said to us is they've said, it relieves all of my anxiety about remembering which medications I need to take when, or remembering whether or not I have to hydrate. Or the simple ones we get from the senior living facility are, I love the fact that I now get a reminder 5 minutes before Jeopardy starts, and not only that, it tells me how to use the remote. That's pretty simple. I think the other one that was very dramatic for us was we had a woman who had tried everything to support her mother living in Florida, and her mother's situation, her health deteriorated. She tried Alexa. She had to ultimately bring her home to Metro West here in Boston, and she moved her in with her and her husband. And she tried an Echo Show. She tried the Echo Show when she was in Florida, and the drop-in feature was working. But then she tried Alexa while she was working and serving her mother in her home, who's on the order of 86 or 87, and really deteriorating. And she found us, and she came and she said, I want to be one of your first pilot users. And then 8 weeks later, she came into our office and spent an hour and a half. And the first thing out of her mouth was, I want to thank you for LifePod because you saved me, you enhanced my life, you enhanced my mom's life, and you completely saved our relationship. Because now I can leave the house and I know that she'll get her reminders that she wants. She has a sort of a relationship with LifePod, and she was really emotional about it. And then her next question was, what are you waiting for? Why aren't you in the market? Why can't I get this, on production? Why can't I get an Alexa unit that has these 2 API extensions that we've asked Amazon for, and we've asked Google for, and we've asked Samsung for? She said, why can't I get all that now? And we said, well, we're going through pilot tests, and we gotta raise money, we gotta build team, we gotta build more software, we gotta integrate all the input we've gotten from all these pilots into a new release and all that stuff. And she said, yeah, but you've got the 3 pieces. You've got the caregiver portal where they can set it up and they can help the person who's being cared for with it. You've got the talking device so that it's totally intuitive for the person who's using it. And then you've got the alert system, the reporting system, where if I say it should alert me with a text message when the person says they don't feel well, then it will alert me with a text message. She said, you've got the 3 legs of the stool, just get out there. So those are the kinds of testimonials, and we've had them so often. It's like whenever it gets tough, I literally simply wake up in the morning and say, we're doing the right thing. This is going to help the world.
We're going to take questions in just a second. Before we do, I want to just sort of conclude my questions by saying I admire the passion that you exhibit over this. And I think it's been one of the great things that we've seen with Voice First FM since launching the network is people involved in voice, whether they're in healthcare or not, they're very passionate. At least people who are good at it are. And so hats off to you. My last question for you is, paint us a picture of where you want to be and where you want LifePod to be in 3 to 5 years' time.
Well, the number of ideas for what we could do with proactive voice are pretty incredible. And having been in the voice space for 20 plus years, this is my 4th voice-oriented company. The first one did call center voice. The second one did Siri for the enterprise, which was when it was all mobile. How do you make a mobile app Sirified, right? And then the last one was avatars for autistic children, where the parent of the autistic child could also be in the background, sort of like the caregiver is in the LifePod model, only more involved because of the complexities of serving an autistic child. So for me, the direct answer to your question is I want to see there being 100 copycat models of LifePod. I don't think it'll be easy for companies to catch us because we've got already got a year of iterative testing of what people want, what the caregiver wants, what they need, what can be automated, and we've got a lot of data on how to make the voice user interface just right, and and we know what's needed next. So I'll just give you a couple of examples on the technology side or the sort of intellectual property side. We've slowed down, for example, the voice of Alexa. I don't know how many skills have slowed down the voice of Alexa, but it seems like an obvious thing, again, to your question. We also are thinking about, well, if you have proactive voice, people ask us this, and they said this about Jibo, which was also a Boston startup. So what happens if you interrupt somebody? Or what happens if you talk when they're watching the television? So you want to combine it with IoT sensors, of course, health sensors, of course, but you want to combine it with sensors that say, well, if there's 2 people talking, maybe I should apologize when I interrupt if it's urgent. Like, excuse me. That's what C-3PO does in the movies. And if you think about what we're doing is we're studying how to act like a fully voice-capable robot who's capable of conversational speech, but we're using it and we're rolling it in a way via healthcare. So we want to be big. We want to be out there. We want to have teams. We're partnering with companies like CCA, who will customize the HIPAA version and the integration with the EMR front ends, of course. And On the other hand, we're partnering with senior living facilities to say, how does it look differently when you're in a senior living facility than when you're in your home versus in a hospital, where, of course, the use cases are also different. So I'd like to have groups for those different use cases and for different cohorts of populations, because we're hopeful, we're discussing a possibility of partnering with children's about how do you use it and adapt it to speaking to kids. But those kids also need proactive voice, but they don't want to speak to a voice agent the same way that a senior wants to speak to a voice agent. So we really will build LifePod with partnerships. We're hopeful that we will build with the partnerships with all the major platform manufacturers. But one other piece that I'll throw in there is that we think that it may be the case, I think someone mentioned it earlier, that these smart speaker platforms may not be perfect for the ultimate AI-enabled voice agent that goes either in the hospital or in the home. Not everybody wants their data with Amazon.
Questions for Stu? Don't be shy. You got the guy right here.
No questions.
Oh. Nate, you got a question?
It's not on my laptop. I just happen to be holding it. What are the scenarios where you do the preemptive wake up? Is it based on movement, the person entering the room? How do you trigger that preemptive engagement?
So,
just the use cases.
Again, a slide and a demo, and I would invite everyone, particularly those Bostonians in the room, to come by and see us on Summer Street in Financial District. But actually, the simple answer is we provide a portal that the caregiver controls. And the portal it now has a second generation user interface because we've incorporated all the input from the trials. And it offers the caregiver 3 choices. They can set up a check-in, such as, how did you sleep last night? Or reminder, which could be anything from, it's a reminder that it's your kid's birthday, do you want to call them? Or a reminder that you have to take your medicine, or a reminder you have a doctor's appointment, would you like the Uber to pick you up in 10 minutes? Or an simplified access to voice services. So that is, it's 5 p.m., Carol, time for dinner. Would you like to listen to some classical music during dinner? Now, she could have easily said, Alexa, play some classical music, but she doesn't have to remember that. She just says yes. So it's based on a calendaring interface that we will be connecting to the existing calendaring interfaces of caregivers, because they already have, in many cases, a calendaring interface. So, for example, a senior living facility in Ann Arbor, Michigan that has 600 beds did a pilot with us, and one of their first questions was, could we not only have the possibility of checking in on all our residents if they all had a LifePod, but also them checking in themselves. So they could wake up and say, LifePod, I'm checking in, I feel great this morning, rather than waiting until LifePod checked in with them. We said, of course, the incoming voice always still works. And they said, that's great because we walk the hallways of 600 residents twice a day. And so, that's on our calendar for every one of our caregivers to make sure that we check every room as part of our service. And it's not that we want to touch base with them less. It's we want those people to be able to do even more constructive things. And staffing, of course, in senior living facilities is the same as staffing with home care organizations. But that's basic answer to your question. We definitely imagine our tagline is giving voice to caregivers. Our second tagline is giving voice to AI. And you said the key word earlier in your presentation. You said the key question is, I have AI algorithms, I have big data to chew on. How do I act on that big data with my AI algorithm? Well, you use the AI of voice to act on that. So when you get a determination of a sensor that somebody has got a gait sensor in their pocket, like Lori said, and you want to tell them that they better not walk around too much or have somebody go in and see them because their gait all of a sudden got, in order to act on that, you want to speak to them. And that's going to be the next generation is prompts will be generated by AI. A simple example where we will use AI in the first going will be simply usage-based. So if I say I don't want to listen to Frank Sinatra 10 times over 2 weeks, maybe I should offer Ella Fitzgerald, or maybe I shouldn't offer music anymore. That's really sophisticated AI, but that's what you can do with LifePod.
Yes, ma'am.
Hi. What kind of opportunities do you see for pharma, medical education, and patient advocacy in your program in LifePod?
Medical education and advocacy?
Patient advocacy groups, is there a fit for them within the platform? Is there a fit for pharma and the medical ed products that they put out? Those kinds of things.
We just presented to a bunch of people at Amazon the other day, and one of the people latched on to one part of our description of how it works along those lines. They said what they really liked about the demonstration of how it works is the fact that the patient's input can be used to tailor not only what services they get, like when do they get reminders, what do they get reminders about, but even how it speaks to them. So that it's not the caregiver alone setting it up for the patient. It's, and that's why we do these elaborate intake sessions. We ask the senior user or the healthcare user, in the cases with CCA where we were working with women who were 55 or 56. They weren't necessarily what you might call senior, but they have chronic diseases. And we asked them, what do you want LifePod to do for you? And so I think that goes to patient advocacy. My father was actually a doctor here at the Deaconess and then the Dana-Farber. And one thing I learned was the voice of the patient is what matters the most. And they rarely feel like they are being given a voice. And so when the patient can actually say, as one of John's patients said, could you tell it to use Brianna's name when it reminds me that I should drink more water? Because then I'll do it. And sure enough, we just typed into the caregiver portal that it should say, Leanne, don't forget to have a drink of water at around noon, because Brianna would really like you to do it. And so that was a specific request of the patient. And as someone said earlier, when these things can talk in a caregiver's voice, like a family caregiver's voice, instead of talking in the voice of Alexa, I think that will be patient advocacy because it will mean more. I had a person talk to me yesterday and say, you know, I used to call my mom and she really didn't recognize me until I sang a song. Well, there's no reason with the power of voice why we couldn't do that for certain patients as well. So I think it's the personal, we call it the ultimate in personalized care.
So, you know, you've used the rightly so, this term relationship, that this save the relationship with the daughter and the mother, the relationships that we build with our patients. Can you talk a little bit of that? Because we really see this as having a three-way conversation, the patient, the caregiver, and LifePod. And I'd love to hear just a little bit more insight about how that relationship is built, how in our situation, you know, we had people interacting 12, 14, 15 times a day with caregivers who weren't there, but their voice was there. So just your vision of how that can even be scaled forward.
How it's scalable?
Yeah, how do you scale that tremendous,
Well,
you know, this ability to take a trusted person, your daughter, your caregiver and everything, and move it through and learn how that's most effective?
Well, I don't know if this will get to your question exactly, but one of the ideas that we've had, which I think is really exciting, was first, is stolen from Amazon, by the way. You know, Bezos has had every idea, hasn't he? So, you know, make it frictionless. The caregivers, there's so much data from the AARP and elsewhere that caregivers, whether they're professional caregivers like the physicians we've heard from today, or family caregivers, really are stressed out. I mean, they don't have time, there's not enough of them, et cetera. And so even to ask them to go onto a portal to configure these routines, even though we're making it easier every time we redo the interface based on testing. That's a lot. So we're doing two things. We got one in the near term and one in the longer term that I think might get to your question. The first one is to have auto-generated routines, where of course we're learning from what works with certain people. Certain wording will work. When you're in voice, as long as I've been in voice, you realize that it's not just what you understand or don't understand, but it's also what you say that's equally important. How you prompt someone to speak to you is equally important. So we will template reminders, template check-ins with the best wording we know how. And we'll say, oh, you want to put in a check-in, you want to put it in then, well, we'll give you a template. It's automatically generated. You don't even have to do anything. And then you can go in and look at it and say, oh, I want to change the wording of that a little bit or change the timing. And then, of course, being a voice guy, I want to make that voice activatable. So I want to be driving down the street and say, my mom has a doctor's appointment tomorrow. Can you just create a reminder on LifePod so that she gets a doctor's appointment, and don't forget to link in the circulation ride or the Uber ride. Boom, that happens. The final one, though, is people have mentioned concierge service. What we're going to try and do so that we can hand it off to partners is study the model where, why should I even have to touch the caregiver portal? Why not have a bunch of LifePodders who are really quick and easy at using the LifePod portal, and who are constantly watching other people maybe use it to support their parents, just in the elderly care space. I'm not saying this is necessarily easily extendable. And then they can call me and say, hey, by the way, did you want me to put in a reminder for that function or that television show or whatever? Or I can call them and say, Julie, has anybody tried this kind of thing with their mother or father? I'd like to try that. And they'd say, fine, I'll put it on and you'll have it tomorrow. And then it's truly frictionless. And we could give that to, and we're discussing this with people like CareLinks and people like Home Instead, who's going to start our next pilot. They could give that to the in-person care companies so that they provide something that's supporting these people when they're not there. So I hope that helps a little bit, but those are a few of our ideas. Sorry.
Last question.
Thank you. John from Boston Children's. Thank you for your presentation. Really excited by some of the concepts you were describing. Seem to me to almost be intervention-based in that if you proactively recommend something, you use a certain wording for a question, you're almost experimenting. Hey, what's the outcome of that? Did the person get up and go for a walk or not? And I'm wondering, to that end, what are some of the first things you're focused on in terms of measuring outcomes, short-term outcomes from the various scenarios you described? Do you think there'll be things like step count? Did the step count change, or are they more sophisticated generally?
Well, the first thing we're doing is we're surveying the caregiver and the user, generally a senior user or a healthcare patient, periodically. So 2 days, 2 weeks, a month, 2 months. And I think the first measure that we're finding is that this combination, and I think it's an important point that I haven't made, so I'll make it, this combination of pleasurable things along with reminders that could be considered a nag or could be considered sort of irritants, combined with sort of utilitarian things, is really important. But that, somebody said it, these people are alone. A lot of these people are alone. And so mitigation of social isolation and reduction of anxiety and reduction of feeling of loneliness is almost an instant benefit of this approach. I honestly think that combined with IoT sensors and big data, it's going to have a much more profound effect, and John and I have spoken about this at length, and I think he has better information about it than I do, on actual healthcare outcomes, because just avoiding people missing in a doctor's appointment or making sure that they stay on track for not even medication adherence, but behavioral adherence, could be such a profound impact that, because we've never seen this. There has never been an online service that's been caregiver service or AI service generated. So that's just a small idea, our metrics.
Interesting. Thanks.
Go ahead.
In June, California passed a new law regarding patients' control of their health data, tightening those restrictions. So I'm wondering where they're allowed to understand who their data is being sold to and can opt out. And given they're allowed to know who their health data is being sold to, potentially, and how they can opt out of that exchange of information.
Oh, yeah.
So I'm wondering how that might be impacting either your business model or how you're going to move forward.
Well, there's two things that somebody said it, I think, but HIPAA to me is an artificial barrier, and privacy and security, although it's critical, and it's like number 5 of our top 5 themes for our company, is also shouldn't be viewed as a barrier. The reason we're so comfortable starting with the elderly space is that in many cases the elderly have a proxy with their either financial or healthcare or total well-being who is a member of their family. And and in many cases, I think healthcare, the whole healthcare environment is designed to be, I'm your proxy for your healthcare. I'm your doctor. I have the proxy for your healthcare. So I think that those are addressable. On the opt-in question, I think is not only the question, but it's also a little bit the answer. When the Amazon people came to us and said, we're really worried about speaking into space, into somebody's home without being invited by that person because we might be invading their privacy. I said, what do you mean? You're listening all the time. If I send something from my son or something, or my daughter sends something to me that plays, that's not invading my privacy any more than you're already doing by waiting for me to say Alexa all the time. But on the drop-in feature, you might have noticed that they developed a bit of an opt-in protocol. You have to opt in order to be dropped in on. And LifePod will follow the same type of model. If you think about, remember mobile push and how mobile push notifications came out about 10 years ago, the first evolution was there was no limitation on who could push what to whom. But boy, did that end, pretty quickly. And everybody says, I don't want anything pushed to me until I opt in. And I think that this will be another thing that we are going to develop, but that the benefits will so far outweigh the risks that we will figure out using existing technologies. Voice print could be one of them, but lots of technologies. We can figure out how to solve that privacy and security question.
Let's give Stu a round of applause.